Hi, everyone. Welcome to Life of Riley's February 2025 webinar, One Health in Action, a discussion on collaborative strategies for healthier people, pets, and communities. My name is Chaitana. I am the Program Director for Life of Riley at Spring Point. And on behalf of all of my colleagues, I would just like to thank you all for joining us today. Before we start and I introduce our amazing speakers, I just wanted to share a quick story with you. So yesterday, I ran into someone that I hadn't seen in years. And I'd first met her about 6 years ago when she was managing a low-cost veterinary clinic in the city where I live. But then I'd lost touch and she's since moved on. She's in the same community, but she's now the executive director of a program that provides programs and after-school programs and opportunities to young people, to children in our community. And she was saying that when she first made this job change, people were like, "Oh, that's a switch. You went from working with people, or you went from working with pets to working with children. That must be so different." And she was like, "Not really, because I'm working in the exact same community and often with the same families." So some of the families that are dropping kids off at her program right now are families that she knew from many years ago when they used to bring their pets into the clinic where she worked. So for a lot of people in our communities, whether they're trying to access health care for themselves or their children or veterinary care for their pets, whether they're trying to access educational opportunities or economic opportunities, or just trying to find affordable housing that will meet the needs of all of their family members, including their four-legged family members, they're coming up against the same systemic issues, the same barriers and inequities. So it makes sense that organizations and leaders in our communities, whether we self-identify as animal welfare or environmental groups or public health or social or economic justice, it just makes sense that we're going to be most effective when we work together across sectors. And when I talk about working together for our communities, I'm not just talking about the nonprofits in our communities. I'm talking about the for-profit businesses in our communities too. We all care for each other and we all do better when our neighbors and our community members are doing better. So I'm really excited to announce today's webinar. This webinar will entail a reflective dialogue on One Health clinic approaches, lessons learned, and aspirations with a panel of individuals actively engaged in One Health community collaborations in 3 U.S. communities. So the panel will be moderated by Geraldine Da Silva, who is Maddies National Director of Programs and Partnerships at Open Door Veterinary Collective. And the panel will include Brianna Kaufman from Humane Health Coalition of Pittsburgh and Vickie Ramirez from University of Washington's One Health Research Center and Clinic. And Adam, who's also from Humane Animal Rescue of Pittsburgh, will also be joining and supporting this webinar. Unfortunately, Dr. Janet Hoy-Gerlach, who originally organized this webinar, had a family emergency and can't join, but I know that this panel that she put together is going to do an amazing job. So thank you all for being here, and I will pass this over to Geraldine. Geraldine?
Thank you, Chaitana, and thank you all for joining us today. I wanted to start on a positive note, but I think it's important to sort of just reflect on why we're all here. We all are in the field of human and animal welfare, and the goal is to help keep people with their pets. And Dr. Janet Hoy-Gerlach couldn't be here today because she's actually given me the permission to share that she is making the difficult decision to say goodbye to her dog today. So I thought we could just take a few moments to pause and just think about Mabel, who is moving on in her journey. Well, sending good thoughts Janet's way. And with that, let's get started. I thought we could start with introducing ourselves, and I'll start with myself. So I'm Geraldine Da Silva, and today I'm representing Open Door Veterinary Collective as Maddies National Director of Programs and Partnerships. I'm also a human and animal welfare consultant, and I work with local and national organizations, helping them create or amplify programs to increase access to veterinary care. So organizations like Project Street Vet and My Dog is My Home and other organizations. So I'm really excited to have this panel with Vickie and with Brianna, and I'll hand it over to you, Vickie, to introduce yourself.
Great. Thank you, Geraldine, and thank you all for being here today. And I'm really excited to be invited to talk. My name is Vickie Ramirez. I'm based out of the University of Washington Center for One Health Research. So we very much look at One Health from a wide scope, ranging from like genomic sequencing to spillover of zoonotic diseases and stuff like that. But for this meeting, I'm coming from our role as founders, along with Washington State College of Veterinary Medicine, of the One Health Clinic and a One Health clinical care model that is based out of Seattle, Washington, but there are a number of different locations across the states. My background's in medical anthropology. I look at ways to reduce barriers to human healthcare, and we do that through that human-animal bond. Brianna?
Hello, thank everybody for joining us. I'm Brianna Kaufman. I am the Assistant Director of Medical Services at Humane Animal Rescue of Pittsburgh. I helped launch Pittsburgh's Humane Health Coalition, which is the first One Health initiative in Pittsburgh. We are partnered with Allegheny Health Network, and we have a mobile unit. And we just had our first successful year, and we're going into our second. And that's why I'm here.
Fantastic. And Adam, would you like to introduce yourself?
Yes, hi everyone. I'm Adam Milling. I'm a master's student at the University of Pittsburgh School of Social Work. Dr. Janet Hoy-Gerlach is my supervisor for this year, which is how I came to be included on this project. So thank you for having me. I'm really glad to be here. And I also work on the Humane Health Coalition with Brianna at Humane Animal Rescue Pittsburgh.
Fantastic. And that's a great segue, because I mean, I want to acknowledge before we start diving into the questions that, there are a lot of efforts happening all over the country and beyond, on the whole One Health topic. And today we're just sort of focusing on a handful of organizations. So I just want to acknowledge all the efforts happening that we're not really spotlighting today. So we're going to have some time for Q&A at the end, but please feel free to post your questions in the chat. Adam's going to be monitoring the chat and helping us with the Q&A at the end. But with that, I want to get started with our first question. So Vickie, I'd like to start with you. How would you define One Health, and what is your One Health approach, given that there are so many different definitions for One Health? The CDC has one definition, but we're all doing it in the way that works best for us. So how would you define that?
Great. Yeah, so for us out of the University of Washington, we really look at that intersection of health between human, animals, and the environment. So when I'm speaking about the One Health Clinic, the One Health Clinic, this model, we, in collaboration with Washington State University, we added veterinary care to existing human health care clinics. Informative work that I did in interviews with folks experiencing homelessness who had animals. Those individuals would often seek care for their animals before they'd seek care for themselves. So we figured that if we added veterinary care to a human health care clinic and had as a component of each veterinary clinical visit, that they at least say hello to the human healthcare practitioners on staff, that perhaps through that human-animal bond and through a positive veterinary healthcare experience, because veterinarians are a trusted healthcare provider, that perhaps folks would be more willing to access human healthcare for themselves. So when we think about One Health, we think about leveraging that human-animal bond to get people into human health, but also after that point to integrate the care that the veterinarian is seeing needed for the animal with the human health care healthcare. So there is a communication between between veterinary teams and human healthcare teams to create single healthcare plans for the family units. So, and when we include environment, we're talking about, we include factors of like where people are sleeping. Is it congregate shelter? Is it outdoors? Is it poor water availability and items like that? So we really look at that interaction between human, animal, and environment.
Fantastic. And Brianna, what is your approach to One Health?
Much the same as Vickie said. We started with noticing in the community that people were getting care for their pets before they were getting care for themselves. We worked with a bunch of outreach workers through the Street Dog Coalition before we began the Humane Health Coalition, and all of our outreach workers were struggling to get people to take care of themselves. So we got together with Allegheny Health Network to provide One Health services at the same time that we were providing pet services. So we provide pet services with our mobile clinic, but Allegheny Health Network provides social workers and outreach workers and housing links and HIV and Hep C testing all at the same time, because people were more likely to get all of it done at the same time. We try to have a nurse and doctor on site, and if we can't, then our outreach partners have the connections to figure out how to schedule them and how to get them connected with the correct people, so that way they have the connections established in a timely manner. And that's the same approach that I think Vickie was saying. So, and it's worked out well for us. So
that's fascinating. That's fabulous. I'm sure we're going to have questions on how do you get like the doctors and nurses involved and things like that. And I'm sure we'll come to that. And I can speak like from my experience, because I'm not a veterinarian and I didn't come from the veterinary field, but in my past work, like when I was the executive director of PAWS, we were focused on providing care for pets, for people who were homebound, who were terminally ill, chronically ill, disabled, and seniors. And I didn't look at it as a One Health sort of approach until, like Vickie said, of course, that is One Health, because we were caring for the health of the animals, also making sure that they were taken care of and they were healthy, and that their litter boxes were clean, and that the home was in a hygienic situation. And so in a way, that was a One Health approach, not in a specific dictionary definition, but we were taking care of the whole family. And we were also preventing the spread of diseases in a way. And in my current work with one of my clients, Project Street Vet, they go out and meet with families who are living on the street, and sometimes hold clinics where they engage with human services and human health professionals. And so with that, they're also helping the spread of diseases, which you can actually see like people's living environment on the streets. So for me, I've come to realize that there are so many different approaches, there are templates, there are definitions, but I've also come to realize that we cannot like get pigeonholed into any one of those. So going to the next question, what would you say is like, what are the first steps to actually get into the whole world of One Health and providing this kind of service or programs for people who are just starting off, and it might seem really overwhelming, or it might seem like they need all of these resources and these budgets and things like that? Would you like to go first, Brianna?
I would recommend the first step to starting this kind of program is honestly to talk to the community first, figure out what the community needs from you, and make sure it's a service that you can provide, and not just a service that you're going to provide to make yourself feel good, but a service that you're going to provide because they truly want it. Like whether you have outreach workers or social workers that are already established in the community that you can rely on to talk to the community to gain that trust, or whether you host a town hall or have a group of doctors that works with the community to actually determine the need. And then once you determine what they need, then look back on your organization to make sure that your organization is ready to take on something like this. As far as like our community, this was a huge need in our community. So we got specific grants for it. We got a big partnership. We had a very generous donor who helped us a lot. So it was something that we had to look internally to see if like we had the staff for it, if we had the supplies for it, because it is a bigger need in our community. The other step would be making sure that there's no littler organizations who are trying to do the same thing that you're going to step on, because then that just causes kind of pandemonium everywhere. Those would be my 3 big steps to anybody who's starting out in this field.
Yeah, I love that you mentioned, like, being mindful and aware of the other resources that might be available, so you're not duplicating efforts. And then those are opportunities for collaboration. So I love that you mentioned that. Yeah, Vickie, what would you say are the first steps?
I'm just going to double down on Brianna's like asking the community what they need, but definitely know your landscape of service providers, because One Health is not about knowing and being able to do everything yourself. It is about gathering all the people who have different skills and different abilities to come together to create a One Health clinic or whatever kind of One Health activity you're doing. And so Brianna came from it from a grant situation. They got funding, they were able to start something. I'm coming from it from an academia setting, so we're able to kind of do it from a research and evaluation side. But I don't think anyone should be scared off that you do need funding or money in hand in order to start these collaborations. You can knit together all the existing programs in your community to work together as a whole. And so in actuality, it isn't as challenging and isn't as heavy a lift as it feels like. And so, yeah, that's just my thought.
Yeah, absolutely. I think it all boils down to, like, collaborative efforts, because it's intersectionality between the like human services and animal welfare, and I think it like that sort of overlap and collaboration is happening more and more now. And I think like it's going to help One Health become a bigger sort of collaborative effort as we go forward. I feel like from my experience, like, going back, like, I love how Chetna started this with a story, and like for me, it's like I had when I was working at San Diego Humane Society, I was the director of the community veterinary program. And I remember before I started that, there was someone who just made a phone call to us and said, I go for my run every morning, and I have my dog, and there are other loose dogs who are just running on the streets, and I don't know how to manage that. Like, do you think you could have, pet supplies or someone to come and help, with these dogs? So I called her in for a meeting, and one thing led to another. She said, why don't you come and talk to our community? So while talking to the community, they said, can you bring your services to us? So we then brought our services to them. We started off with, low-cost vaccines and pet supplies. And the people that attended that event then told us about the other human service providers in their community who could partner with us. And then that's how it grew, because we were listening to the community, because we didn't understand all of the needs that they had. And so I feel like, as intimidating as it might seem, your first steps might come from simply answering a phone call, or listening to a story that someone's talking about, and trying to identify an opportunity that might exist in your community.
Can I just add one thing, Geraldine, before we move on from this question? I think one thing that really helped us is that we had an advisory board early on in our clinic, and half of the individuals on our board were people with lived experience. And so it's listening, it's listening to the needs, but also including them in the whatever rolls out, so that you have that continual voice like, hey, this is not working because of this. And I won't know that because I don't have that lived experience.
Absolutely. And that's why like a template might not, it could be a guideline, but it may not be the absolute format, because then you're adapting it based on what your community needs.
Yeah. So in case anyone's interested, we do have like a lot of people reached out to us to see if they can recreate this kind of clinical care model in their communities. So we do have a template, and absolutely, as Geraldine said, you cannot put a program in rural Arkansas as you're going to put in Seattle, urban Seattle. So it is for modification. And Adam, do you mind dropping that in the chat, the One Health Clinic toolkit? This is a free toolkit that anyone can use. It starts you from the very beginning, asking these same questions that Brianna answered, like, who do you talk to first? Who can you collaborate? It leads you through the whole steps of what to do.
Fantastic. And maybe like we'll have some questions on that like at the end as well, Vickie, because I think it's so rich and y'all did so much sort of background work before y'all sort of created that. So I would love to sort of circle back to that at the end. What would you say is a lesson or some lessons learned through like, trial and error that you think would be helpful to share with others if they're thinking of starting a One Health program, or they're even trying to get into this kind of a model?
I'm unmuted, so I can go first. I have two lessons that we've kind of learned. One, our first few, because we have a mobile unit, so we're out in the community more often than anything. And our first two clinics were held in locations that were a little bit more intimidating for our clients. And we basically didn't have anyone show up, and we were internally panicking a little bit of maybe was the need perceived and not actually gonna go anywhere. But when we looked at it, I think it was the locations were just not right for the clients that we were trying to reach. Because then after that, when we went into different areas of the community, we have been flourishing ever since, which then leads into the second lesson that we kind of are still navigating through, is that we grew very quickly, and we're still catching up with that. Our clinics kind of exploded in a way that we were a little unprepared for, and we had to go through a lot of trial and error as far as like how the flow worked, how the paperwork ran, how the clients got from point A to point B. Like we did not anticipate our reach spreading as quickly as it did. We were expecting like our little group of community people that we knew were going to be there because we had been working with them for so long, and then it exploded into all of this community. Everybody knew about us, everybody saw us on the street, everybody was running down to get us, and we're still navigating through that, but we've come vast far and since those couple of events, with our scheduling, our flow, our paperwork, we finally, I think, gotten it down.
Yeah. So, I mean, if you're saying like, it just suddenly like sort of exploded like that, like how did it spread? Was it word of mouth, or do you promote your clinics? How does it?
We promoted a couple of times, and then it was mostly word of mouth. I think a lot of word of mouth. We only promoted we promoted the first few events. But then as the promotion got spread and as the clinic started to grow, we kind of were like, hang on, let's slow down on the promotions, let's slow down on the news, let's slow down on the flyers getting posted everywhere, because we were like, are we ready to take on the more people showing up, the 50, 60, 70 people showing up? Do we have the staff for it? Or do we have the time frame for it? So we did have to like put a stop on like the media and the flyers and all of that stuff, because we didn't expect it to get quite as far out as it did. And then I think now it's just word of mouth. We haven't really done many promotions in probably 6 months, 7 months. And we're still jam-packed from start to finish at every event.
Right. I know that we hadn't sort of like really talked about like having that as part of a question, but I feel it might be interesting to the audience to sort of actually talk through like, what would your typical like flow look like from start to finish, like with your clinic on a typical day?
My clinic specifically.
Mhm.
So we start with the paperwork for the vet side, because it takes longer to get into the computer system, because we do everything. We try to do everything paperless, so we can print labels and stuff like that for all of our meds. But they actually most of the time make first point of contact with our coordinator from AHN. So they make point of contact with AHN, show up to the event, get their pet's care, and then either while they're waiting for pet care, if we're like running behind, or after they do their pet care, then they can get pet food, because we do offer that. So like any pet supplies they may need, and then any human services that are available. We're all kind of like usually right like in a circle almost around each other. So we're all right there. So if there's downtime waiting, our social workers and outreach workers are right there talking to them, making the connections that they need. After the event, they're making sure they're getting home or to wherever they need to be okay, home, a bus ride, anything like that. So we're all like right there kind of on top of each other, intermingling with each other.
Fantastic. Yeah, because I know, Vickie, like you apply more of a case management approach, and I'd love to hear about that.
Yeah, so our clinics, the individual and their pet arrive and they're met with who we call a navigator. And the navigator is their buddy for the whole course of the clinical experience. So depending on flow and timing, they'll either see the human health care first, primary care, or the veterinary care first. And that navigator goes with them to both clinical visits and notes all the clinically relevant information that they can pass on to the other healthcare provider in order to ensure that the care is being integrated. So, for example, we've had situations where they went to human health care first, and then they went to the veterinary care for their cat, and their cat, they mentioned that the cat was catching rats in their household, but then we learned that during the human healthcare visit, they did a pregnancy test. So we're able to talk about toxoplasmosis in real time because that navigator has passed information back and forth to the other teams. And then in higher pressure situations, the veterinarian and the nurse practitioner will work together in collaboration to create care. And we've had situations like that where we have a dog in end of life care, diagnosed with cancer, untreatable, maybe 3 months to have a good quality life before maybe transitioning on. But the owner is on methadone. So how do you keep the dog not in pain but maintain the sobriety of the owner? So those conversations happen in real time. So it's very, our numbers are low per clinic because the care is deep. So if we see like 10 pairs in 3 hours, we are slammed. But I'm very excited because we're looking at 2019 to 2022 data right now. And we are finding that approximately 50%, I don't know the exact number right offhand, approximately 50% of the folks coming in haven't had human health care for 2 years prior. And the majority of those maintain follow-up care for the following 2 years. And so ours is really about creating those positive healthcare experiences so that folks can continue on with human healthcare.
Fabulous. That's so impressive. I mean, when I think back to when we like just piloted like a One Health approach, we reached out to like the family health centers of San Diego, and we were fortunate enough to speak to one of the case managers who loved animals. And she said, I would love for you to just come on site to where our clients actually come to meet with us, because then we can have them bring their pets. And that was fortunate for us because we were able to just bring our services on site. And then we found out, like, there was someone who hadn't met with his case manager for months because his cat was sick. And so he only came to meet with his case manager that day because he knew his cat was getting care. So it's all like it's a win-win like that. And we didn't have anything sort of organized in the way you have it, Vickie. But at the same time, like I only mention this because for someone who wants to start it, who wants to just start it with having your table on one end and human services on the other end, you could still do it that way. So going on to the next question, what is something that you have learned that you wish to tell others related to One Health work? Anyone? Brianna?
Something that I have learned is that not everyone's going to be grateful for what you're doing for the community. And not everything's going to work out the way that you think it's going to work out. And that's okay. You'll get through it. People, are going to continue to push try to demand more of you, will always try to guilt trip you into doing something, will always try to bend the rules because they want more. And even though it's something that you're putting your heart and soul into, it's just never going to be enough for some people, and that's okay. It's for me personally, like the most rewarding thing I've ever done in my career. So you have to take the good with the bad. But it is something that like you think that sometimes you're doing the absolute best that you can, and it will never be enough for some people, but that's okay. That's what happens in the world sometimes. And I worry that some people don't always, they take that sometimes to heart. And I never want anybody to take that to heart because it's okay to still have boundaries.
Yeah. Vickie? I can repeat the question.
Yay.
What is something that you've learned that you wish to tell others related to One Health work?
I'm just going to reinforce it's not about numbers. So you'll see other organizations that say like, we vaccinated 500 dogs today. But when you're doing One Health, I mean, we get so excited when we're able to support someone into healthcare. But when you're supporting people into healthcare, you're also, if there's case management around, we function within a shelter that has case management and housing management and training, internship possibilities. If you get one person into housing because you were there for their animal, it's such a rewarding feeling. So yeah, and again, back to not a numbers game, but
absolutely. Yeah, because you're providing quality work. And sometimes to get someone to share information about their own health, I mean, it takes time to have that conversation. You can't just jump into it. So yeah, absolutely.
I want to double down on what Vickie said. It's definitely, we do approach it differently. But I have been very cautious about making sure that I can give quality work to the people who are showing up within the hour. So we see more than you guys do. We average about 30, but I don't want 60 people to show up and I have to take away from the 30 people that I usually do see. So I agree with you. We're doing it a little bit different. We're usually doing mostly preventative care, but I still want to give the same quality to the people that I'm giving preventative care to that I would be to anybody else. So I don't want 100 people to show up and I can't see more than 30 people. So I have to agree with that. It's not about the numbers. It's about making sure that everybody feels respected and appreciated all the time.
Absolutely. Absolutely. And I love that you were kind of reinforcing that. I feel from my perspective, I feel like I'm an optimist and I feel there's always a way, and so when we didn't have our own veterinary team and people were asking for help with their pets, we found that there were like human health care events happening. Like there was the Veterans Village of San Diego organized an annual stand down event where it was actually an event where they were receiving comprehensive services over the course of 3 days for humans, and the people with pets weren't accessing those resources. But we didn't have a veterinary team, so we reached out to Banfield Pet Hospital and we were like, can you come and help? And they said, but you need to pay for all of the medical supplies, and we didn't have a budget for that. So then I reached out to Banfield Foundation and I was like, can you sponsor the medical supplies? And they sponsored it. But I feel like again, I'm mentioning that because there's always a way, because you just need to look at the organizations whose missions align with the work that you're doing, and then you can all again collaborate and come together and offer services. So we were then able to take care of the healthcare of the animals while people were getting the healthcare that they needed, and that was also a One Health approach in its own way. So I just wanted to mention that as well. So there's always a way. So this question is about any areas of resistance, barriers, or pushback that you may have experienced, and how did you navigate that? And it could be like, internally or with your leadership or externally, whatever it might be.
I could start. When we started our clinic in 2018, the big, people create their own, reasons why things will be difficult. And then maybe when it comes to, when you start doing it, it's like, oh, actually, that wasn't really a problem. So what we were hearing before we started, and then never again, was that private veterinary clinics would be upset if we would start providing free veterinary care to the community, because somehow that would be a competition. And so that was what we were hearing from, oh, you better watch out. The veterinary community is going to get upset, whatever. And once we started, everyone realized it was nothing. It was like a whole big nothing burger, because these folks weren't going to be accessing private veterinary care anyway. And so it was a imaginary barrier that we set up for ourselves. Oh, we can't co-shelter. We can't have animals in emergency homeless shelters because of allergies. And then you talk to people who do it and they're like, you just put them in a different corner and everyone's fine. We create our own barriers. And so that is something that I learned pretty well through.
Absolutely. Yeah.
We definitely had the same barriers in Pittsburgh. The verbatim the same private practices were like, you can't do that. And we were like, well, we're going
They say
to.
it. Yeah, I don't even know who told us that, but everyone was telling that. And then when it happened, everyone was like, hey, can we volunteer at your clinic?
Yeah, right.
So it was weird. It was weird.
We have the barriers here that there's people in the community who don't necessarily support just in general. I'm sure every place has that. So we don't really do anything. We just ignore them because they're not really fighting us. They're just present in there, and we know how they feel.
Is it they can't afford to take care of themselves, so why do they have animal people?
We do have a lot of those.
Okay.
We also have a lot of the just general, they don't want those quote unquote kind of clientele in their neighborhood type of thing. So we just make sure that they're not actually talking to our clientele or being mean to our clientele while we're out there. Because I think those are probably places everywhere has those, and you'll probably never get rid of those kind of people no matter how hard you fight for them. So their fight against them. We did have some when we first launched this, some barriers internally, mostly because it was people didn't understand what the program was in its entirety, and they didn't understand how the funding worked in its entirety, and they were really afraid that we were pulling all of the funding away from the shelter. And then once we all explained that, like, that's not happening, we're not pulling from the shelter, we're not pulling from the day-to-day, we're not doing anything to harm that, and the program, and explained the program in its entirety and what the purpose was, we got over that pretty quickly as well. So, but that was our barriers mainly.
Yeah, absolutely. And also, like, I feel like sometimes I feel like the barrier can be time, like, because when you're trying to navigate and figure it out, and make a case for it, like internally within your organization, you need to truly make a case for why you feel this is going to work. And so it's almost like you're like putting in the time to learn about how it's going to work and how it's going to benefit the community, so that it's a high priority item, just like saving animals' lives, like in the shelter, as there's a high intake. I feel like I also like to look at barriers, like on the flip side, as opportunities, and how we can sort of navigate that. And for example, I found, like, and it's almost a segue into the next question about, like, how do people get to their appointments, because you have your clinic set up, and then you have your staff and your volunteers and everyone set up, and then people cannot get to their appointments. And so one of the things I found was the barrier to transportation. And I still remember there was a gentleman, his name was Jose, and when we were going door to door in an underserved community, he first said he had one dog, and then we found out he had three, and then he had 7 dogs, and then he didn't know how to get them to their appointment to get them spayed and neutered. So once we developed this trust with him, we didn't have any way to get these animals in. So I told him I would take them, because by then he had developed some trust with me. And so we brought, like, clean new crates, because we loved his dogs and we wanted to make sure that he, his dogs were going to be well taken care of. And I took the dogs to the shelter. We got them spayed and neutered, and he was waiting at his door, at his gate, for the time that I'd given him when we were going to bring the animals back. But if we hadn't provided transportation, he would not have had access to his animals getting spayed and neutered. And with that, we were able to actually set up a transportation in partnership with Uber. And that was thanks to Open Door Veterinary Collective, who had initiated the idea where we could create, like, a step-by-step guide. And so with that, I just want, before I share what we are doing, I wanted to check with you, both Vickie and Brianna, how do you ensure that your families get to their appointments?
We last year had some grant money for Ubers and Lyfts. This year just it's in our budget. And we use Ubers and Lyfts mostly. We host all of our events on the bus lines, but the buses in our areas don't let dogs on, so people can use it for cats, but you can't use it for dogs. So mostly just Ubers and Lyfts, and it's just allocated in the budgets. It's mostly AHN getting people to the events.
Okay, and do you add it as a transport line item in your One Health budget, or is it in the overall budget where transport is just like helping with other programs as well?
It's in my budget specifically. It's like I think it's a line item.
Okay.
I don't know how AHN budgets theirs, but it's I know it's in their budget. I think it's just a line item for transportation.
Perfect. What about you, Vickie?
Can you get, like, a student to start working with the public transit system about changing rules about dogs on buses?
I know one of our community can't remember his title right now, but somebody who works at the shelter has been working with housing for sure, maybe the transportation, to try to work around a lot of these policies in the city. So I know it's probably in the works.
Yeah.
So our policy is that you can have a dog on, but they just have to stay on the ground. They, like, can't sit in the seat.
I think ours have to be, like, in a bag, so
So we can do like the IKEA bags, like they do in New York. Have you seen those, like full
Yeah.
big pit bulls in like the IKEA bags?
Yeah, I mean, 90% of Pittsburgh seems to be pit bulls, so people are going to start putting pit bulls in bags.
I love it.
Yeah, you know, it's
Transportation for us is just because we're on bus lines and we allow for pets, and then the shelters we work with provide bus passes for. So I don't really have a good answer for you.
yeah, and that's okay, because what we've realized at Open Door Veterinary Collective, that transportation, and when I say transportation, I mean pet rides to and from appointments, is it's a big need, it's a big gap. And so we've started the conversation. We've created a micro learning nugget. We've created a step-by-step guide in partnership with Uber. So if people want to start their own pet ride program or transportation program, they can just I think Adam has some links that he'll post in the chat. And then that way, at least it's a start. And Open Door was offering, small grants as well for people who wanted to pilot the program, and it turned out to be really successful, and it's really easy to implement. So I encourage people to try it out. Also, there are some organizations that utilize volunteers or their humane law officers. So we're going to be having some more sort of panels to talk about how to address that gap. Okay, so the next question, which is actually our last question, is what is a future One Health direction that your team has identified and is working towards, and why?
There you go. We actually have two. We're trying to get more into senior centers and assisted living, because right now we've only been there one time, but it was a good turnout. So we're trying to focus more on that community this upcoming year. We've identified a few places. We're just trying to make contact with them. And our other goal is right now we're all free, but we've had quite a few clients who want to give us something. So we're trying to set up a way for them to donate if they would like to. Never required, but optional if they would like to. Because we've had a few people try. They want to contribute something to us. Makes them feel good. So it's not required, but we're trying to get that working. So those are our two goals for this year.
Fantastic.
Yeah, on our side, because we're come from academia, we are trying to evaluate programs to show like that this model of care really exists. So I told you a little bit about the data earlier. So we should be submitting to a public manuscript early or end of this week, or maybe early next week. And we do make all of our publications open access when it's pertaining to homeless services, so that everyone has access to it. I just wrote a grant that I'm super excited about that I really hope gets funded. And that is working with a shelter in San Diego who they have their own federally qualified health center on campus, and that FQHC is creating a detox and treatment center on site for those experiencing homelessness to access treatment, but they are going to allow for co-sheltering during treatment. So a lot of times, this is something that will come up if you're working at One Health clinic with any population, but that folks will want to access detox or treatment facilities, and they need fosters, and fosters are so hard to come by these days, especially since eviction moratoriums are up and all that type of stuff. But this organization is going to allow for people to stay with their animals while they're getting detoxed and getting treatment. And so we're hoping to evaluate the benefit of like having that companionship and love and, maintaining that while in a treatment experience, and seeing if that is actually more beneficial than detoxing solo without any kind of family member with you. So that is very exciting. And always pushing, speaking out about how One Health is housing. It's co-sheltering, it's co-housing, and really just trying to push that importance of keeping people and their animals together. And I do really want to suggest, if anyone wants to learn more about that and about like One Health activities and all really interesting things, the My Dog is My Home conference. It's a virtual conference and it's at end of March, and it's a really good opportunity to network and engage with people and just learn about all these kind of animal related care and animal related projects going on internationally. And I do know that their registration increases on March 1st, so register today.
That was a good plug, and really an important one, because the conversation is also happening beyond the United States. We have representatives from, and I say we because both Vickie and I are on the board of My Dog is My Home. We have representatives
Little bias, sorry.
Yeah, from the UK and from Spain, and then you kind of can see how there are similar efforts happening in other parts of the world, and how different sectors like co-sheltering and housing are also like interconnected with the work that we're doing. And like to sort of circle back like to the question, there are all these organizations that are doing their little bit. And so hats off to everyone who's doing their little bit. And I highly encourage everyone to look for like what Brianna was saying, look out for what is out in your community, to collaborate and see how y'all can build on the efforts of what people are doing already. Maybe there are opportunities for joint funding even. So like you could show how human and animal welfare is working together for a bigger cause to help people stay healthy and happy with their pets. So
on that note,
mm-hmm.
One Health is really hard to fund because there's no organization that's like One Health funded. So you just got to look at all organizations, animal focused, human focused, environment focused, and write grants to all those for what they're interested in, and then squish the other stuff in. So that's just what I've learned over time.
Yeah. And is it okay for me to say, Vickie, if anyone in the audience has questions, if they're writing a grant or like a proposal, if they wanted to sort of reach out to you for ideas, is that okay?
Absolutely, anytime. I was the SME on Pittsburgh's grant, so absolutely anytime.
Fantastic. Well, thank you both so much. I know we're almost at the top of the hour, and we also needed some time for Q&A. And so I'm going to hand it over to you, Adam, to see if we have anything in the chat or our Q&A.
We have something here from Julie, who says, I know that this webinar is about One Health approaches in the US to help make people and their pets healthier. Where I work in the global south in the country of Nepal, I was initially surprised that people weren't accustomed to taking their pets to see a vet for preventative care unless it was a real emergency. But when I learned that most people don't even go to see a doctor unless they are sick or unless they have an accident, it made a lot more sense. Do you find similar cultural differences in the communities where you work? And how do you encourage people to think about preventative approaches for both people and animals?
Would anyone like to take that?
You start, Geraldine. This is your jam right here.
Yeah, I'm going to have the question right in front of me so that I make sure I answer it. It's such a great observation and question. I've lived in India and in the UK and here, and I've taken our services into Mexico, into Tijuana, and I feel there are so many things. One is the actual veterinary deserts where people might live in. They may not even have access to healthcare for themselves, leave alone access to healthcare for their animals. And most of the people, and I'm sure Vickie and Brianna can speak to that too, the families that come to these clinics, a lot of them have never seen a vet before. And so there's that as well. They don't even know about what they need for their animals. So, for example, when we took our veterinary team to Tijuana, we held a clinic in a human healthcare facility that was closed that day. And there were people who brought their animals like in a diaper bag, and they just closed it, or in a wheelbarrow, and like with a like a cable as a leash and things like this. And they didn't even have access to simple resources. And when we said, what is it that you would like for your animal today, they said, whatever, like whatever you can give our animals. So it's almost like going back to first figure out like even sharing information with them in terms of what they might need. And the interesting thing was, when people came to us, they were even asking for contraception for themselves. And I was thinking to myself, we're at a human healthcare center, and we have partners providing spay and neuter services. We are doing wellness care for the animals, and we could absolutely set up a One Health clinic. So like going back to your question, I feel like, it's almost sort of looking at each situation for what it is, and speaking to the people, looking at your resources, and looking for what might work. It might just be that, you just provide transportation to get them to where they need to go as a starting point, and maybe then go from there. And I also want to say that, I give kudos to like my former teams that I worked with, because we are getting into the space where we're hiring veterinary social workers, case managers, and things like that. But our teams who are boots on the ground are also working as case managers, because they're navigating all the resources. They're figuring out how to refer people to the resources that they might need. So they are also people that you could sort of speak to and get more information. And I would love to hear if you wanted to unmute, Julie, and share some of your experiences.
Can I just add one thing before Julie comes in? And Julie, definitely come in. When we started considering about creating a One Health clinic, it was actually in response to activities done in, I think, Kenya, where they would provide vaccines for livestock. And they realized that whole families would come out for that event. And so they're like, well, all these kids are here. Maybe we can vaccinate the kids. Well, so it was actually based on these kind of global One Health is way stronger than US One Health at this point. They've been doing it for much longer, and they have it. We just created a One Health North America academia conglomerate where Southeast Asia has had one for years. Afro Hoon, Sia Hoon, all those things have been going on for years and years, and we're kind of late to the game.
Hi, this is Julie. I think it's better if I maybe just contact you offline and let some of the other people get their questions answered, but I'd be happy to tell you about what I'm doing and maybe pick your brain. But everything you said is right on target about not only, deserts of access to care, but all the other things that you mentioned about just education and not even knowing what I always like to say is they don't know what they don't know, and they don't even know the right questions to ask and what kind of care to even provide. The whole concept of vaccinations. I mean, most pets over there don't get anything but rabies. And so you find that very often there's lots of parvovirus and other distemper going around and killing street dogs left and right. So it's a completely different situation than what we have here.
Absolutely. And yeah, we should all absolutely connect. And I also would like to add that we also don't know what we don't know, and so we are learners in this field as well. And we are educating ourselves, because only by going into the communities and recognizing that, for example, there are no veterinarians there. They have no means of transport. once we understand the landscape and the lack of access, we can then create the resources and support that the families and community needs.
One other thing I'll just mention is that in many places, and we even see it in the US, is people don't want to collaborate because they feel that there's competition. And so this kind of work really needs collaboration. And, I'm a big fan of groups working together across different sectors. And that's very difficult in some cultures and some, areas where people are clamoring for support and funding, and they're afraid that if they work with others and share information that the other group will benefit and they'll be seen as the leader. And so there's lots of issues like that as well.
Yeah, absolutely. And I feel like, that's it's sad. And I think like when we're in the life-saving business and keeping pets and people together, I hope that we can sometime reach like, an even ground where it's not about competition, it's about like, making it a better world. So yeah.
All right. Our next question is from Sandra. She's wondering, does Seattle serve the same clients regularly, or is it new clients coming in all the time?
In our youth and young adult, so we have a few in Seattle, but we've running the youth and young adult clinic for much longer, is that we do see return clients. And that's what we hope to see, because then the human health has opportunity for like establishing even better, stronger human health care. So we do see, we do like on any given day, there'll be like 1 or 2 new clients and then returning people. And that's what the wonders of vaccines for dogs are and pets are for too, because they have to get their boosters. So that means they have to engage with the human healthcare again. So we do see folks, always new people, but lots of return people.
All right, next one is from Amy. She's wondering, how do you assist people who have animals with medical conditions that your vet team isn't able to treat themselves, or if their animals need emergency services?
Yeah, great question, Amy. And it actually, we at Open Door, we're creating a learning module where we're actually going to be addressing this. It's about providing veterinary assistance. So it could be anything from, veterinary vouchers to referrals to other organizations. So Pet Help Finder is a platform that Open Door Veterinary Collective has, where it has all of these resources where you can refer people depending on their needs. So it also lists emergency veterinary care and specialized care, whether it's for seniors or orthopedics or whatever it might be. But like for the most part, like at least in the work that I did, we had a veterinary voucher program, and I'm happy to talk to anyone who is interested in setting up one, because it's not a complicated process to set up partnerships with veterinary offices and create a simple fundraising program where you can raise funds and restrict grants just for specifically emergency care and for the services that your program doesn't provide. And then you can work with veterinary offices and refer people to these services, and again build in your transportation program so that if they then need to get their pet to that appointment, you can provide transportation to get there. I hope that answers your question. And I'm happy for you to reach out to me if you have any questions.
So, and then this is the golden opportunity to create relationships with the other organizations going on in your community. So when we started early on, like Julie mentioned before, there was a lot of like being like scared to like collaborate because what happens if they get my money? Or just like kind of weird things like all these organizations helped this one animal, but then an organization would say, we did this, and then without calling all the other organizations that were participating in that care too. That has evolved tremendously since our early days. And Seattle Humane actually started a Slack channel that there's about 50, I want to say, organizations on. And so we're like, we can go into the Slack channel. We're like, we have a parametra. Can anyone help? And they were like, yes, we can help. And so creating that kind of network has allowed us ways to kind of get emergency care, or like this group will give $250, this group will give $250, and we all pull, because it's all the same clients. So we all work together to serve the people we serve. So really knowing your community is a really nice way to go about it.
All right. Next question is from Lori. She's curious whether you have seen significant movement in non-animal focused funders' understanding of the relationship between human and animal health and welfare. Do you think it's getting easier to get funding for this work from those funders, or are you still having to work as hard as ever to tailor, in Vickie's words? Also, in what ways could we reach more funders to educate and entice them?
I love challenges, and I think, in our field, we have such powerful, truthful stories. And as long as we are respecting the families that are sharing their stories and we have the permission, I think weaving those stories into our grants in an appropriate way, where we match the data. There's a lot of research that's happening as well. I know Sloane's on the call, and she's doing a lot of research in the field, which is really going to help us. And I feel telling your story, if you're talking to human welfare groups and weaving how their life is so much better because of their companion animals. And when you're talking to animal welfare groups, talking about people who are caring for these animals. And so, again, coming back to One Health, this is like a whole family unit. It's one unit. And making a case for that, because a lot of funders are also, pet parents. They have pets, but they don't think of it in this way, that it's impacting families who are getting separated, like a person who is, for example, fleeing a domestic violence situation and only has their animal, and then they're told that they need to surrender their animal before getting access to services. Making those cases where it's not going to help this person by giving them shelter if they don't have their animals, so they're going to choose to stay on the street, and then their health is going to deteriorate, and there's the spread of diseases. You could sort of weave in your stories in whichever way, but keep it authentic, and you will be heard. You will be heard.
Vickie or Bree, do you have any advice on how to engage funders?
I'll be honest, I don't know that I've ever written a grant, so I don't really know what goes into writing grants. I just usually provide the data. And I think we got really fortunate with the person or the foundation who gives us the grants is worked with the shelter for a while, so they had a general idea of what we were doing. So I think we got fortunate in that. But on any advice, I don't really know what goes into a grant, so I don't want to steer anybody in the wrong direction. I just provide the data. I have a spreadsheet that's very nicely tailored for the data, but that's about what I can do.
And the data is super essential. So however you can evaluate your project, that whatever kind of program you're doing, however you can evaluate, try and maintain that data. In terms of funding, we're in a brand new world for funding. So I don't know if I can give you an answer to.
If anybody wants any suggestions on how to make a spreadsheet, I got you. I'm really good with spreadsheets, but that's where I draw the line.
Absolutely. And I think that's where it comes together, right? So someone's a good storyteller, someone's good data gatherer, someone's like tracking and reporting out. And that's a huge part of it. And I think like maybe like even touching upon like, what software are you using to track your data? It could be just a spreadsheet. There are programs like Clinic HQ, which works great for clinic management. So that you can then run your reports in real time. Like if you know that there's a funder who needs something on the number of, if they're supporting people experiencing homelessness, for example, you could run a report on just that, depending on the software or the data that you're tracking. If they're supporting veterans, you could run that data, or things like that. So you could also, like, I think that's a great point that you made, Brianna, about a spreadsheet, because I think like looking at what you're tracking so that you can report out for your grant writing would then all tie in.
And then think about your community, not like, yes, your community, but your environment, because okay, during COVID, everyone's like, I'm in lockdown, I'm going to get a dog, I'm going to get a cat, whatever, right? And then there was no veterinary care. And so now there's under-vaccinated animals, there's under-spayed, neutered animals, and those have disease impact on the environment. Like we're in Seattle, we don't have terrestrial rabies. So our rabies are all in vets or whatever. So we don't have any on the ground like animal rabies, but a lot of states in this country do. And so you can tie that in specifically to like public health. We need to get these dogs vaccinated for rabies because they become a public health issue. We need to get, East Coast has, y'all have a bunch of like Lyme, like ticks, right? With Lyme disease. Like we need this veterinary care and it will help humans. So really look at what's happening in your immediate area and approach it from that as well.
I have a question for you all. If there aren't, Adam, are there any more in the chat? Am I just butting in?
Nope, the chat is all clear. So
sometimes I imagine you have clients, Brianna and Vickie and Geraldine, who kind of come in and they're making choices that you don't agree with. So you may have a client who comes in with a pregnant dog. You may have a client who is not so much interested in spay, neuter, or in general, there are just other choices. People have different views on euthanasia of animals, and it's not because they don't care about their pet. How do you handle this, and how does your team handle conversations with clients that you just might not agree with? And do you still provide them with services?
I'll go first. So we have a policy on spay neuter, for example. Not every animal that comes in has to be spayed or neutered, but we don't support breeding because we can't, as a shelter as a whole, we can't support that aspect of it. But we will give the care for one appointment and have that discussion about the importance of spay and neuter, the risks associated with not spaying and neutering, and then inform them that we can only give you this one appointment. And then after that, they are on their own to find further vet care. And then what they choose to do after that is what they choose to do after that. As far as the euthanasia policy, we haven't actually really run into that. As far as medical decisions, most people, they're like, oh, if that's what you would recommend, let's absolutely do that. And we actually, I don't think, have run into anybody who's like against vaccinating or anything like that. It's the spay and neutering that we run into the most. But most people are very understanding and they're like, okay, I'll take this one appointment and then I'll go to somewhere else after this.
At our clinics, and that's a very good approach. Because we see clients, we see people coming back over time. It's not like we have this pop up here and then people come, and a pop up here and people come. Folks are coming in. They may even be living in the shelter that we're providing the care out of. So we have more hands-on opportunities to take a little bit more of a harm reduction approach to spay neuter. We do not ever require it, but it is a conversation that happens throughout every visit that they're ever going to come in. And we find that a lot of it just comes down to, just lack of information and knowledge about things. Like the whole concept, I'm sure everyone's heard it, like they want to give their female dog the opportunity to experience motherhood, or the cat to experience motherhood. And we start having these slow casual conversations about, like, some animals don't want to it's that whole um yeah, just like whole like peopleifying of the animals. That, or like, I heard that a cat should be 1 year old before getting spayed. And so we can talk to them like, well, they can get pregnant at like 5 months. So let's have this conversation. Like, so because we have more touch points, we have the opportunity to guide folks. When it comes to breeding, we also have this, we say we cannot support the animal. We'll support the mother and we'll get the first round of shots into the babies, but we have a cap of how many animals they're allowed to bring in a given year. And so that also, with it's our young adult population, also we've had to create these kind of protocols because of there are those who are like really loving with their animals. And this is like also with housed community too. So this is like, just like that disposability of like animals after like you give it to your girlfriend for Christmas and now it's not a puppy anymore, that kind of stuff. So we kind of have to create those kind of rules about that.
Yeah, I mean, I have, I'm actually deliberating whether I should even share this, but I think it's important, and I don't know how to be politically correct. So forgive me if I overstep. But like, when I was growing up in India, I rescued a dog off the street, and he was like my first dog, and I was so happy. And he was not very well behaved, but we just loved him completely. And the trainer suggested that we have him neutered. And I felt like it was a violation, like it was his right to have like all of his body parts. And so like we never got him neutered. And I couldn't understand, like at that time as a child, like the importance of it. And no one could convince me to neuter him, because I felt like I was his voice. And everyone has like their own reasons. And this is a story which I share not very often, because it might affect some people. So just forewarning, when I was working at in a previous role, we used to have pet families coming across the border and receiving pet food. And we would provide, a bag of pet food, sometimes two. And we had a gentleman who was coming across the border and collecting some food. And then he started talking to us and asking for more food. And then we slowly found out, as he built trust with us, that he had a few cats, and then he had many cats, and then he had many cats. And I had pushback from my team saying, we should not be giving him more pet food because he has all of these cats and he refuses to get his pets spayed and neutered. And I said, but it's taken so long for him to trust us, to tell us that he has these cats. So we need to keep this trust. And a little warning here, this is horrible, but basically when we asked him, like, what were you doing with all of these cats as they were born, these kittens, he said he was drowning them. And he felt that was an act of love, because he felt he didn't know what to do with them. Like he couldn't manage it. And so it was really hard for me, because I felt like, my team felt we should just stop giving him pet food, and he didn't deserve it. But I felt now we had his trust and we needed to keep him coming. And honestly, it was the riskiest decision I made as a leader, but it was one of the best, because it took him a long time to understand that if he didn't get his cat spayed or neutered, this cycle was going to happen, and he was so sad that he had to keep doing this to these kittens. So he finally started bringing in his kittens, and we started spaying and neutering them, and we were able to continue that process. And so I'm so proud to work for this organization called Project Street Vet, because their motto is no judgment, just help. And I feel like, having that as like the forefront in the way we approach the people that come to us for help, because we often don't know why they are making the decision that they are. And it sometimes takes time and patience and building trust. And I know that the story is really hard and probably controversial, but I needed to share that.
Can I add something? I recall being on a presentation. I'm not going to remember the organization, so I very much apologize. I know it was happening on tribal lands, and it was a group that was told a story about a woman who had a dog that she very much loved, but she also very much bred and would sell the dogs. And then at one point, the dog had a pyromatra, and then that veterinary, they provided care for all the animals. Like Geraldine was saying, all the babies they would provide the care for. And then at one point, the dog had a pyromatra, and this veterinary care team was trusted and asked for help. They got help, and now this pet parent is like the spay neuter, like just telling everybody about the importance of spay neuter, because she almost lost this dog that she loved.
Yeah.
So if you can play the long game, then I definitely, it's challenging because you see a lot in that time period.
All right. Well, Adam, it looks like we don't have any other questions. So I think that's kind of a good note to close out on, I think, because this work, this being human, is super complicated and messy. And working with other humans is super complicated and messy. And we are in complicated relationships with the other species on this planet, right? And so this work is hard work. And I think this webinar and all of you on this call were such a great example. Thank you, Geraldine, Brianna, Vickie, and Adam. You're such a great example of we're all just in this to take care of our communities. And we have to do it. There's no one way to do this. So we build partnerships with people who are doing different things, and we go in without judgment and with understanding, and we just try to make things better. And sometimes we make mistakes and we screw it up, but then we just get up and we try to do it again. And this is how we are going to be in community with each other. And this is how we get through hard moments in history. And this is how we're going to get through this moment, is that we're all just going to keep taking care of our communities. You're doing amazing work. Thank you so much for coming and sharing with us today. Thanks to all of you for being on this call. I will be sending out a follow-up email that has the bios of all of our participants, of all of our panelists today, and also some of the resources they've shared. They've shared a bunch of great resources in the chat, so I will put those and some additional emails, some additional resources in the follow-up email as well. I'll put the registration link in for the My Dog is My Home conference. I'll put my plug in for that conference as well. I went last year. It was amazing. And finally, we are planning some really exciting programming for next month. I don't have the dates yet, but I will put that in the follow-up email also. So stay tuned. Thank you all for being in community with us today, and have a great rest of your week. Bye.